Hello and welcome back to Life 360. Now, in our previous episode on obesity, we spoke to Dr. Taruna, who took us through the modern interventions of losing weight. And there are so many interventions that she spoke about. However, I felt it would be better rather for you out there, if you want to lose weight, who is at a better place to speak to you than a person who has been through that journey. Now, allow me to introduce to our guest today, who will tell us about herself and graciously take us through the journey, and maybe just tell us about herself and when did she know that it is now time for me to begin the journey towards losing weight. Welcome.
Thank you, Ruby. My name is Judith Thathi. I'm 53 years old. I'm married. I have one daughter. And now my weight loss journey started on October 3rd. That was after I had problems with both my knees. They were paining and I had to use a crutch to walk. And I was actually overweight. But before then I had a problem with my hip, which was operated on 2014 in India. I had a total hip replacement. This also came with my weight. So when I came to see the doctor, Dr. Mohit, is when we discussed about my knees, but I'd met him before in 2019, but that was COVID time, around that time. So I felt I needed to wait a bit for COVID to go down, but I waited too long. So by the time I was coming here to see him, I actually was getting up from my seat by holding on the chair with my hands, and then like kind of bending over before I started walking a bit, and I was in pain. I couldn't even walk 200 meters without a crutch. I was always in pain.
So maybe you've mentioned about your knee and hip issues. Maybe when did it begin and how did it feel having all these problems without actually tackling the weight and maybe wanting to lose weight in the first place?
I think from 2012, I started seeing the doctors, the hip doctors, actually orthopedic doctors. Then I had two opinions, which I was not very happy about, which I don't think I'll disclose because the doctors. But when I had the third opinion, is when I realized that I can actually go to India and have my hip done, because the doctors here were telling me I'm overweight. But the doctors from India told me I'm not overweight, that they can actually do it as long as I'm not 170 kilos. That's when I went. Actually, my leg was 1.5 inches shorter, my right leg. So they advised me to go and do the hip replacement because it was becoming worse and I was still using a crutch at that time.
Now you mentioned that now you went to India to seek for treatment for your hip replacement. How much did you weigh then, and maybe how was your general health when it comes now to other underlying conditions?
If I'm not wrong, at that time I weighed like 120 kilos. But no, the problem was my leg was already short. I was actually limping on the right side. So I was always in pain and I used to take painkillers every day.
When you talk about your weight and maybe feeling like your weight is an issue, did you have weight issues growing up, or is it something that is in the family, or is it something that just happened somewhere in between your life and your life choices when it comes to lifestyle and all that?
Actually, I've grown up having weight issues because from my dad's side, the genes, we have the weight issue. Yeah, but also my lifestyle was a wrong lifestyle because I was a junk person, chips, chicken, junk as in junk, proper junk, crisps, chevra, popcorn. I would rather eat junk than eat proper food. That was my lifestyle. Yeah.
Now, eventually now coming here, meeting the doctors, what are the procedures that you went through? Like, did they check your weight, your height, your, any other parameters that pertain to body weight, and which procedure did you undergo?
Actually, how I knew about the doctor was through my brother. He had the operation done in 2019 and he lost like half his weight. That was like 3 years ago. And that's when we started discussing that I would like to do the operation, because my knees were actually giving in completely. I could barely walk without pain. So when I came to see Dr. Mohit again, actually had come to tell him like, I'd like to book my operation for January next year. No, sorry, not January next year. What I meant was October. Yeah, January next year. Now that was this year. I'd come last year. So he asked me, you came the last time, I remember meeting you, and you've come back again. You're actually in total pain. Your knees are in pain. You need to do surgery. Why don't you try the weight loss? So I had not made up my mind then, because it's an operation. So, and I insisted I wanted to go to India. But he told me, but I'm doing it here. Why don't you want to do it here? I told him I wasn't prepared. So he asked me to make up my mind, but I was with my family. So we sat on the side and they were like, in so much pain, why don't you just have the operation done? So I actually had the operation done. Actually, I came in on the 2nd to see him and had the operation done on the 3rd.
Basically, which procedure exactly was this? Was this the balloon, or which procedure was this exactly?
I have high blood pressure, so, and my weight. So he told me that I should do the mini gastric bypass. There's a screen, and they make the 5 incisions. And then they operate, they cut the stomach into half. And they stipple the stomach and make it smaller. And they stitch the intestine to the stomach.
What exactly you're trying to say is that now they reduce the size of your stomach to make sure that you're eating smaller portions of food?
Okay, previously I could eat anything and everything. Until I'm full. You know, kawaida. You can eat anything and everything. But after the operation, you first start with the liquid diets, which even at times are very hard to take down at 40, 50 ml. For 2 weeks, then you increase to the heavier liquid diet, which is still a struggle. And the water intake, which is still a struggle for the first month. But there's medication, which you need to take religiously without fail.
When you came to see the doctors, how much did you weigh then, and now how much do you weigh? And how long has it been between the time you came in and now?
When I came in, I was weighing 141.3 kilos. Today, I weighed myself, I'm weighing 100.6 kilos. I've lost like 40 kilos in 5 months.
Wow.
Yeah.
I can only imagine how that made you feel now that you've lost all that weight. How has it been for you?
I'm overjoyed. I'm so happy. It's a new life. It's given me a new life. My hip is okay. It doesn't pain. It only pains when it's cold because of the metal I have. And my knees are very okay. In fact, the best thing that has ever happened to me is that I'm swimming twice a week.
Now, compared to what you used to eat before, maybe take us through your diet now. What do you eat in a day, and how is that helping in your journey?
I take 3 main meals. That is breakfast, lunch, and dinner, and snacking in between. But it depends with your body. When you know, we are all different. Like, I had an acidity problem, so the doctor recommended me to eat something at least every 1 hour or every 2 hours, according to how the body feels. But my intake is still minimal.
Someone who is watching us today, and maybe they've been procrastinating going to see the doctor, yet they have similar issues or even worse, what would you like to tell them?
Weight is a problem. It took me time to come, but I wish I came 3 years ago and did the operation, because it has saved my life, as you can see. It is hard, I know, but you have to be ready completely. completely, you're ready, you need to go through the surgery. It's life-changing.
In this journey, how has the community around you, talking about your family, your friends, the people around you at work, how receptive have they been of your journey and so far where you've reached?
My family has helped me a lot. They've walked with me, especially my husband and my daughter. My daughter was my nurse. My husband was also my nurse because the things you can't do. You're not allowed to bend, you're not allowed to lift heavy things. You can't actually cook for yourself. So they prepare for you the meals. When I'm unable to eat, they encourage me. My family is overwhelmed. My aunties, my uncles, my cousins, everybody, they are walking with me in this journey. And it's so encouraging. Yeah. They are very happy, very, very happy for the change that I have today. Yes.
As women, I think it will be unfair for us to finish without actually talking about the change of wardrobe, how you felt changing your clothes from the previous way you used to dress and now, and how has that even affected how you feel and view yourself generally?
Actually, when I had my weight, when I was actually heavy, I would dress in deras and vitenges. Vitenges that are just big so that I can cover my weight and they're long. But now I've embraced fashion. I mean, clothes that just below my knees. I'm actually able to wear coats with my two dresses and you can see the waistline. Yes. If they are long, like I'm feeling this long and big now, I need to look for smaller ones. I'm telling you, I've become fashionable. I'm even putting on jeans and tops. It's very amazing. Wow. It's the best thing that has ever happened to me.
Thank you very much, Judith, for sharing your story, and I believe it's going to go a long way in actually making people realize that what they need to do, they might be feeling like they have underlying conditions or health issues, but basically health, or rather their weight is the problem. Thank you very much. And to you, my viewer, thank you very much for tuning in to this end. And remember to stay tuned for us. We will be telling you more stories about this. We'll be talking to other patients who will also tell us which procedure suited them. And as of you, also consider visiting Third Park Hospital here in Parklands. And you could see a doctor who will also tell you which procedure suits you, what is your weight, what do you need to do for you to actually make sure that you're living a healthy life. Until next time, this is Life 360. My name is Robbie Omondi. Bye-bye.